Hello there, my name is Steve from Cardiff Pain and Performance, and I'd like to talk to you today about one of the most common causes of back pain that we actually see here in clinic, and that is namely coming from the hips. Because when we walk, the hips actually need to internally rotate around about 6 to 8 degrees, and that internal rotation happens when my back leg is in full extension. So when my leg is in full extension, in order to walk correctly, my hip actually has to internally rotate. And that internal rotation, unfortunately, is one of the first movements that actually starts to go when we have hip arthritis. And so as our hip becomes a little bit more arthritic, generally speaking, it's the internal rotation movement in the hip that will go first. Unfortunately, because arthritis is such a glacial, such a slow process, often the movement into the hip, the ball and socket joint, can actually reduce very, very significantly, and the patient will never ever know it. And often the first time that they come into clinic, they'll actually just be complaining of the low back and not at all the hip. And often what they'll be complaining of is just a gradual tightening in the low back that starts as a general tightening in the morning, and then when they get going they feel a lot better. But then slowly over time that tightness doesn't matter whether they're standing up for a long period of time, sitting down, the tightness never goes. And most people then assume that the problem is in the back. But in this sense, the back often isn't the bad guy. The way that we describe it is the back is actually the good guy working really, really, really hard because the hip isn't moving, and it's not moving in internal rotation. And so when the hip doesn't move in internal rotation, the back moves a little bit too much. In order to stabilize and protect the back, the muscles tighten up even more to try to protect the back. That causes injury and irritation and inflammation in the joints. So one of the first things that we assess when we have a new patient into the clinic is actually how much movement there is in the hip. Because if the hip doesn't have between 6 to 8 degrees of internal rotation, then absolutely that patient won't be able to walk correctly. And being unable to walk correctly, that rotation has to occur somewhere. It happens in the pelvis and the lower back, which is not favourable, but is compensating, and then the muscles tighten up to protect you. I hope you found that helpful and insightful, and if you do have any questions, please pop them in the comments below. Thank you.